This conference will now be recorded.
And then consider whether or not we're going to take this through to our clinical practice. In the last 5 minutes, we'll wrap up and plan for the next session and look for volunteers and get some feedback. So through this journal club, what we're trying to do is to introduce an interactive journal club where one of the nominated hospitals and a representative sets the clinical research question that they're interested in, searches through the literature and identifies a piece of evidence that we'll be able to appraise. And then in the next section, what we do is we want to appraise as a group together to then decide whether or not we take this through to our clinical practice. And the idea here is that we're trying to get the question that comes from clinical practice, everybody joins together to be able to practice evidence-based medicine and apply it and see if that changes our views. Just briefly onto the evidence-based medicine principles. The evidence that comes out from these studies is obviously very important and is linked to the clinical expertise, the environment and the patient, but it doesn't fully overlap, and we need to really use our judgment to be able to integrate them all together to see whether or not we want to change our clinical practice. So today what we're doing is Christine, along with representing Chelsea and Westminster, will be going through the clinical scenario, the focus question and the search strategy. And the idea here then is to appraise the evidence and then decide whether or not we're going to make changes to our practice. And what we're trying to do is learn by example through the first section and learn by doing through the second section. A little bit on how we set our focus questions. What we're trying to structure it around is the PICO format, so the patient, population, intervention, comparison, outcome, and timescales. And Christine will be showing us through the clinical scenario how we do that today. And it can be used to look at questions about various factors, including treatments, tests. And it is a tool, and it just helps us to clarify our question that we have, our clinical question, and to be able to address it in a systematic way. And before we move on to the clinical scenario, really quickly just want to highlight how we decide on the hierarchy of evidence. And obviously different studies are suitable for different questions that we're asking. Some of them are much less prone to bias, like randomized control trials, and may be preferred, but again, depends on the type of question that we're asking. And the quality of the individual study matters. And Christine will be taking us through how we applied that in this clinical scenario as well. So we'll quickly move on to the clinical scenario so we can get to the appraisal. So I'm just going to give me a second. I'll just get on the clinical scenario.
Definitely, it should be in the slides you're looking at. It's the next slide.
It's last week. Lord,
oh,
that's why
did I?
Yeah,
sorry.
That bit is not right. I'm just getting Christine's one. I think it's this one. No. Bear with us, sorry guys. I'll just go onto the Dropbox.
Yeah, definitely. It's in the Dropbox, the one that's there. I've definitely got it in because I've just opened it on my computer and it's fine. So as long as it's synced, it should be fine. Let me just check my Dropbox is synced. Never easy. It says it's up to date.
There we go. Got it.
Yeah.
Brilliant. Okay. Sorry, Christine. Please take over.
Perfect. So introducing the clinical scenario, you are a pediatric SHO at Chelsea and Westminster Hospital, and you've seen a 3-year-old with presumed viral gastroenteritis. He's tolerated his fluid challenge, his blood sugars are normal, he's suitable for discharge, and at discharge, his mum wisely asks you, should I give him a probiotic? So A&E is not too busy, and you decide to put your newfound EBM skills to the test. And you come up with the clinical question, which is, in children who are less than 18 years old with viral gastroenteritis, will the use of a probiotic reduce symptom duration or hospital admission? And breaking this clinical question down into the PICO parts to distill the important factors, we have a population which is children who are less than 18-year-olds with gastroenteritis, and the intervention that we're looking at would be probiotics, comparing it to our standard of care, and looking at an outcome of the duration of symptoms or hospital admission. So with the search, I did a search of a few databases, including PubMed, Ovid, Cochrane, and TRIP, and the numbers in red highlight the numbers of results that I've got. So in each search, I've included the synonyms for different parts of the PICO question. And it does look like a lot of results, but going through them, I realized that many of them are actually not related to the PICO question, and also considering the pyramid of evidence, because what we're considering in this intervention is a treatment. So ideally, we're looking for randomized controlled trials or systematic reviews, which if we go into the next slide, the RCTs and the systematic reviews are right at the top of the pyramid. So of all these results, I narrowed it down to 4 systematic reviews, and I've only included 3 there because the 4th one was a Cochrane systematic review in 2010. So it was the oldest one of the lot. So I haven't included that. But out of the remaining 3 that I have there, I looked at the size of each study. And the one from the Nutrients Journal had 1,298 patients, so we ruled that one out and considered the other 2. The one in the World Journal of Gastroenterology had 4,073 participants in 19 RCTs, and the other one in Elementary Pharmacology and Therapeutics had 4,208 in 18 RCTs. So that one was larger and also seemed a better fit to our PICO question because it addressed the duration of diarrhea and hospitalizations. So we ended up going with that paper, and although it was a journal that I was not familiar with, the first author had published other papers on the topic, and we found that that journal had a greater impact factor than the World Journal of Gastroenterology. So that is the systematic review that we'll be looking at today to answer the PICO question.
Excellent. Thank you so much, Christine. I'm just going to load this onto my computer so that you can see. I noticed that someone said that it's too small. Susie, if you're ready as well.
Yep, so if we just take a straw poll and either type or speak, who would advise the parent to give probiotics, yes or no? Before we even look to this evidence, who would say to mum, yes, give the probiotic to your child, or no, don't give it? What are your thoughts? Either. We're getting some no's there. There's a yes. What's everyone else thinking? People aren't sure.
What do Northwick neonates think?
Lovers of probiotics at Northwick?
Abstaining.
It's not like them. We've got, oh, they're saying no. Northwick has said no. 1, 2, 3, 4. We've got 5 no's and 1 yes so far. and everyone else isn't sure. They would just say to the parent, I don't know. Okay, so next we'll move on to the actual task. So what we need to do is split into groups. So if you click on the number generator that Andrew's posted, if you're group 1, you're looking at the validity, and if you're group 2, looking at results. So just to run through, everyone should read the abstract, and then if you have a number 1, you should be looking at the methods and the demographic table, which isn't actually in this type of paper, but just read through the methods. And then if you're a number 2, you're looking at the results. Andrew's posted a link. The paper isn't open access, so we've got a copy of it there, and also the CAS tool, which is where you should be able to type directly. So if you're at home or if you're in a group, if you use that and type on your answers in either validity or results. If you have 20 minutes to do the task, if you're very efficient and you've finished validity, you can of course move on to results. And if you finished results and you want to move on to validity, you're more than welcome to. But if you just want to take your time, you have 20 minutes to work through the task. So just take your time and do as much as you're able to. And if you are stuck or have any questions at all, just type them into the chat, or we will get back to you.
And I've just given a very small note to say that rather than the demographic table, which doesn't exist in this study, if you're doing validity, you might also want to review supplementary table 1, which tells you about the studies they included.
Perfect. So just to break it down a bit further, so for the validity, you'll be going through each question, one question at a time, that just breaks down looking for different types of bias. So in this type of paper, you're wanting to look at, well, how did they find the studies they've included? And it'll break that down into the different steps, and you're looking to see if there's any kind of obvious flaws or any bias at any point. And then if you're looking at the results, you want to be looking to see, well, what do the results show? How precise are they, which is looking at the confidence interval. And is it a beneficial or is it a negative result? And is it a reliable result? Oh, Northrop Parker said the Dropbox is blocked. Can you type the paper so they can Google it? It isn't open access, so you have to go through Athens to get it.
In the meantime, I'll try and stick it somewhere else as well, maybe on a Google Drive.
Yeah. Okay, so the actual title of the paper, I can just read it out here and you can type it straight in.
Give me an email address if you're struggling and I'll email.
And then we'll do the applicability part together, which is where we look at the study and see if we can apply it to our local practice. So 20 minutes, you've got the pro forma. And if you just type directly into that, we'll give you some time reminders. And we've got some helpful slides that we'll rotate through. So if you're joining or if you're needing a bit of hand with the terminology. Okay. So
we'll be returning back at 25 minutes to, unless the, how many people are having problems getting the paper? Can you guys, if you do have any problems, can you write it into the chat box? I think Andrew's last link to the Dropbox should be available to all. Correct me if I'm wrong, Andrew.
Yeah, and I've just repasted it for those that have just joined.
Perfect. Okay, so it's now just after 2:15, so actually we'll get back at 20 to 2 to discuss what we think about the study. I'm just going to put up a set of slides just reminding us of certain terminology that's coming up in the paper as well as in general. Thank you very much for that, Sudeep. It's in the LSB Massive group as well, if you can't get access to the paper. In addition to that, if you do get any questions that you wanted to ask before the 20 minutes are up, just give us a text on the chat and we'll see if we can help. 5 minutes left. Okay, everybody, we're just going to get back together to discuss now. So I'm just going to hand over to Andrew for the discussion bit. Thanks, Andrew.
Hello, everybody. Welcome. Thanks so much to everyone for joining us, and welcome especially to the UCL students. I saw a question from Wolfik about not getting the reference to S1. That's because it's in the supplementary material, which was about 35 megabytes, and I couldn't email it to you. So that's only in the Dropbox folder. That was just a summary of the included studies. I confess I'm not sure that there is a flow diagram of the search presented. Susie might be able to clarify that. All right, so Defna is getting up the blank critical appraisal pro forma. So she's going to put down our thoughts as we bring them together. So hopefully about 50% of you have been thinking about the validity of this systematic review. We invite your feedback. You can type it. You're very welcome to type it, but it's always lovely to hear some voices as well, whether from the students or from our paediatric teams who are present. And I guess particularly those who are joining in teams, maybe you can nudge the most vocal member of your group to speak to us. So question 1, are the results of the review valid? So that's section 1, so that's validity. The first thing is, do you think that this review addressed a clearly focused question? Please give us your thoughts. Oh, I've got a no, I've got a yes, got a yes. Habab, what makes you? I'm interested to know, Habab, who says no. What gave you? What worries do you have about the lack of focus? Okay, we've got some more yeses. All right. Okay, so it looks like we're getting a majority saying yes, it does ask a focused question. So I think we can put that down definitely. Fine. Okay, and what did you think of their choice of types of study to search for? Do you think they appropriately chose the right study designs to look for to answer this question about an intervention? Oh, yes. Yeah. Should they have included observational studies? Okay, pretty consistent, yes. Excellent. Fine. And then the next one, what do you think of their search strategy? So do you think that they searched the right sort of databases with the right sort of searches? And did they use other techniques to try and find the best studies? Okay, so we've got one negative comment there. Jordan's saying they only use one reviewer. That's a fair point. So you often like to see that reviews are done in duplicate so that discrepancies can be resolved. But Angarad points out that yeah, they look for unpublished material. Yeah, reference lists. Yeah, including of other systematic reviews or non-systematic reviews. So it does look like they put quite a lot of effort, yet no exclusions based on language. So it seems like they did a pretty good search. Okay, and what did you think of the means that they used to try and assess the quality of each study? Okay, so use Cochrane risk of bias tool. So that's a pretty standard approach. It's been around for a long time. Has anyone come across any different ways that people address quality of included studies in other systematic reviews? Oh yeah, thanks Jordan for replying to Norfolk Park there. So just worth noting, you might see that lots of systematic reviews in the last 10 years particularly have moved to using a system called GRADE, which is a bit more comprehensive and covers not just assessing the quality and the risk of bias of individual studies, but also through to how you turn your results into recommendations at the end. So it's often used in guidelines. All right. Super. Right, and now possibly one of the more difficult questions, and this is one where perhaps it might be worth if there might be some oral discussion to be had. What did you think of them combining these studies that they found? And there's two elements to that. There's the elements of how similar the studies were in terms of what they were studying, the patients they included, where they were done, whatever, all the sort of factual things you could say about the studies. And then there's also the comparability of the results and how similar the results actually are when you pool them together. So there's a few elements to that, and it's not a straightforward question. What do you think? Yes, Angrad pointing out there's a lot of heterogeneity, and just to, so yes, Angrad's pointing out heterogeneity, and just to be clear, I think what you're referring to there is the heterogeneity of the results. So we call that statistical heterogeneity, that all the studies seem to be showing quite different results. And Jordan is saying that when they break it down by different factors, it does seem to affect the results. And George is pointing out they did have to do a bit of work to combine the results of the studies, and that's often the case. So sometimes you want to do a systematic review, you wish that everyone reported their results in exactly the same way. Alas, we don't live in that world. So sometimes people might report the same results to do with, stool volume or time to resolution, but give the results in different ways. So they used what seemed to be reasonably well accepted means of trying to convert those into means and standard deviations that they could then pool. Certainly less than ideal, but if you ever have several hours to spend and want to wade through the Cochrane handbook, it goes into all of these issues of how you might convert things from one form to another. Not a straightforward area. Sadiq points out that how they might define, so different studies might report the same outcome, but how they define that outcome could differ. And so we've got what we might call study heterogeneity, differences in how the studies were conducted, and we've also got a large amount of heterogeneity in the results, and perhaps we'll talk about that more when we actually get to the results section. All right. Now, what do you feel overall? So I'd be interested in your, do you think it was, given the differences, do you think it's reasonable to rely upon sort of summary estimates, meta-analytic results from these studies when the results are so different? Or do you think we should have just summarized these results in a narrative way? Yes, so a bit like me, it's sort of, I think, sometimes it gets down to you've got to look at the results. And we pointed it out in the slideshow that we went through, but with heterogeneity, it's not so much about is it there or is it not. It's partly about how much heterogeneity there is. And it's also about is it affecting the direction. So actually, if you have a set of heterogeneous results, but they're all pointing in the same direction and saying, one treatment is better than another, then you can say, okay, well, we still feel relatively confident that one treatment is better than the other. We are just much less certain about the extent, the magnitude of that difference. Whereas if the heterogeneity means that some studies are saying treatment A is better and some studies are saying that treatment B is better, then actually it's giving you, it's really affecting your certainty in the direction of the effect. Yeah, Jordan says, could it have been better if you only used the most similar studies? I don't know, that sounds to me like introducing quite a lot of bias, sort of saying, oh, well, all the ones that are sort of sticking out and look a bit odd, we'll just exclude those. I think that would create a lot of bias if you just sort of threw out the ones that you didn't like because they were sort of sitting out there on a limb. Okay, so so essentially it looks like we're sort of in the middle on that. We look at the results, but we know we're going to have to be a bit cautious about the interpretation. So that brings us to section B. What are the overall results of the review? So it might be worth reminding ourselves what our particular question was. I'm just bringing up the slides for myself because there were particular outcomes that we were interested in, and this study reports those and some others. What key results have those who got number 2 pulled out? So we were thinking of duration of symptoms, we were thinking of hospital admission. So does anyone want to give us their thoughts on the key results from this study? What were they? Okay, so Eve says there was a reduction in duration of the diarrhea, got a sort of point estimate of minus 0.85 days. Okay, and that was one of our key things. Yeah, we've got allegedly. Might be interesting to know what makes Northwick add that caveat. Yeah, got a confidence interval, minus 1.2 days to minus half a day. Beatrice says supports the use of probiotic because of the reduction in duration and the hospitalization. Okay, well, that's something we'll certainly think about when we get to applicability. What does anyone think? What do you think if we were to say we believe this result, and we said, yeah, the probiotics are reducing the duration of diarrhea by, on average, just less than a day? How enthusiastic does that make you feel about recommending them for treatment, whether for a parent to buy themselves or for routine use on prescription paid for by the NHS? Joshua, probably not recommend. But it's much cheaper than lots of the stuff that your neurology friends use, Joshua. Angarad, only 1 day, is it clinically relevant? Cost benefit, single day less of diarrhea, not that great, yeah, might be, but not quite sure how much these things cost, but you would hope they're not super expensive. Okay, potential side effects, yeah. And that's, so when you think about side effects, sometimes you need to go, so you need to think, you know, have they reported it in the study? So really worth saying, have they reported anything about adverse effects? And they said 8 studies reported adverse effects, but found no real difference between experimental and control groups. So that's a bit of reassurance. But actually, when you've got treatments like probiotics that are often used for a broad range of indications, you can potentially cast your net wider and look at other studies as well. Okay, so what about then applicability? So this is where we start to think, you know, so can we apply this evidence? We've got this systematic review that's pooling studies from all around the world, and that's done a little bit of subgroup looking at European studies. It's looked at inpatients, looked at outpatients, and found results that, fair to say, are heterogeneous. But if you look at the European one, if you look at their forest plot, you see that's one of the examples where, although there's heterogeneity, all of the studies seem to be pointing in the same direction. But, you know, still a lot of heterogeneity. So how do you feel? Do you feel that we can apply these results to children in our emergency departments? And please, you're very welcome to unmute your microphones and speak, especially if you're in a group. Pick an extrovert, make them speak. Ah, okay, Norfolk can't speak, that's all right. Okay, so yeah, Beatrice is saying, yeah, the European results perhaps are a little bit more encouraging. Yeah, I mean, I think it might be more interesting to break it down into sort of low resource and high resource settings, and I'm not sure that they did that, because I think we might hypothesize that that might have more impact upon effectiveness. Yeah. And I guess it's interesting to me that actually, despite all of their subgroups, all of the breaking it down, they never really got rid of all this heterogeneity. So often what you want to see is there's heterogeneity in a meta-analysis. If they start to break it down into groups, what you often see is that the heterogeneity reduces a lot, because suddenly they're taking away the differences in the studies and they're grouping more similar studies together. But that doesn't really seem to happen here. And of course, as Norfolk points out, there could be all sorts of background things to explain differences in efficacy, which could be differences in exposure to antibiotics, differences in gut microbiome, differences in nutritional status, differences in the pathogens, differences in vaccinations. There's all sorts of factors. Yeah, and yeah, so this was all, and Joe points out only one probiotic, yet all of these studies were of the same probiotic. So this isn't a general meta-analysis of the efficacy of probiotics. Those have been done as well. Sometimes they get criticized, of course, because then you say, well, you're not testing the same thing. Yeah, and what's not presented in the main results is when they cut it down to just a handful of studies that were of the highest quality. So I think there were 5 studies that were at the lowest risk of bias, which you'll see in the supplementary material in figure S9. You then see that actually there's still a lot of heterogeneity and the result is no longer significant. So there is a sense that these results are not robust. As you start to restrict yourself to the most high quality studies, you start to see less evidence of effect. So we've got 4 minutes left. So I think this is the point. So any other outcomes you think should have been considered? Give us a thought as to whether you think they missed important outcomes. All right, fine. Well, let's. Okay, we've got someone who Jordan says, yeah, mostly important outcome, but bunch of them, yeah, absolutely. And that's not unusual in meta-analyses. You know, you often find that there's 1 or 2 things that are reported by most studies, and then a smattering. The other outcomes may be only reported by a smattering of studies, or reported in different ways, so you can't meta-analyze them together. So let's get your views, a straw poll as we come into land. Can you tell us, we got answers in the beginning as to whether you would advise this parent that, yeah, giving a probiotic would be a good idea. Who would be recommending this mother, yeah, go and get a probiotic, that's a great idea? And who would be saying, no, don't bother? Okay, very quick responses now. And the denominator is larger, so we're getting much more responses. Susie's demonstrating a bit of equipoise there. Maybe it'll make people feel better just to be giving something. But this is resounding no. All right, so we moved from 1 out of 6, I think, saying yes, to 0 out of something more than that. All right, super. Well done. Great work. Thanks for that. I think I'll hand back to Daphne. So our bottom line is we're not convinced.
Excellent. Thank you so much, Andrew. And thank you, everyone, for taking part and being so interactive. We, as always, really value your feedback. And here is the link for the feedback, please. And we've also put it into the chat box so that you can just directly click onto it and get onto it. Andrew's just posting some useful links there to remind ourselves about places that we can look at and use for evidence-based medicine. And we want to also take this opportunity to find another hospital that might be interested in next week's journal club. The subject is neonatology, so it's going to be a neonatal paper. Not that I'm looking at the name titled Northwick Park Neonates, because there's no other neonatal group there, but would you be interested in Northwick Park Neonates? And if they're not keen, would anyone else be